Real quick, kind of lightning round
I'll try to
type
be
thing.
quick.
Some things that you would not vote for the bill if they were included. Just kind of yes or no. This needs to be in the bill. Taxpayer-funded abortions. Would you support that or oppose that?
No, I'm not going to support that.
Okay.
And it's not in the bill.
Right.
You should know that it's not in the bill.
What about abortions funded through premiums, through health premiums?
No, I mean, you're talking about private industry?
No.
Private industry has obviously plans where there's obstetric care that exists, and people pay for obstetric care, and if for some reason there's something there.
That would be more on a public option. If there was a public option and then those abortions were funded through those premiums, would you oppose that if it was in the bill?
I don't think there's going to be a public option.
Okay.
I think it's going to be a competitive option out there that'll be more of a nonprofit. So, and I don't think it'll cover that.
Would you oppose a public option?
I think it's going to end up being, as I said, not a public option, and it's not mandatory.
Sure.
That's another thing that's important for people to know. I think what we need is a competitive option. We want a competitive option so that there's something real, something tangible there for everybody to choose from, and that also kind of helps to keep the insurance side of things honest. We did that in the prescription drug component. We had a fallback. We didn't end up using it because there was a lot of competition among private industry and the private insurers. So we didn't really need it. But just making sure that there's a choice there, a competitive choice. I certainly would not support a public government-funded plan. Okay. That's not a competitive choice.
Any health insurance benefits for non-citizens, for illegal aliens?
No, absolutely we're not going to provide health insurance for illegal immigrants, illegal aliens. And that's not in the bill now, that's for sure. There is no funding for illegal immigrants.
Okay. Mandates on insurance, requiring people to have health insurance.
Well, I think it's going to be important to look to people for responsibilities. We've got to have the responsibility side on the side of the employers, and employers have been great. We've worked with a lot of the big industries across the nation. I have a shop bill, which I did working with a lot of small businesses. NFIB came out and supported us on what we were doing to try and encourage the marketplace, create. My philosophy has always been government's not there to solve the problem. Government needs to provide the environment that industry can solve the problem. And if we provide a pool where small businesses and self-employed people can pool themselves, just like we do as federal employees, then the private industry is going to serve them in a very practical and realistic and meaningful way, which right now there's very little for small businesses or self-employed people to get in the private individual marketplace. So, I believe very strongly that we've got to create an environment. The exchange, I think, does that. I would like to see the exchange on a national level because I think it would create greater efficiencies, greater savings, and administrative costs.
Sure. Let me just get one last one, and then I'll let you go. A statement you made last week that you since apologized for. You're talking about the town hall, people at town hall meetings, and said, I think it's un-American and disrespectful, referring to what they're doing. Explain exactly what you meant and where that comment came from.
Well, I'm sorry I said that because I do strongly believe that every American has the right and the opportunity and should have the opportunity to voice their concerns and to speak out, and certainly that's a part of our freedoms here in this great country. And I probably misspoke in using that word, but I also have to believe, and I know that most Arkansans were raised like I was, and my parents raised me to be the best possible American I can be, the best possible Christian I can be, the best possible neighbor I can be, to be respectful. And I think that's what's important. I felt frustrated because I do believe that we live in the greatest country on the face of this earth, and it takes each and every one of us, with all of our different ideas and solutions, to come together and figure out how we do a better job of keeping our country ahead and making sure that it's solid. And so it was a poor choice of words, and I didn't intend for it to be meant that way. Sure. I just think it's important for us to put aside the differences. That's why I'm working in a bipartisan way to try to get a health care plan. But also, I think putting aside the differences and making sure that we remember that our conversations can be respectful, that we can disagree without being disagreeable. that it's important to be respectful of others who are there to visit and talk about the things that are important in ways that we can solve these problems. And I hope I didn't offend anyone. I certainly had no intention of doing that at all. I feel like, as I said, that the way that I was raised is that you look for results and you look to solve problems. You don't go off to the side with one little group and try to solve a problem. You bring everybody together and you work constructively together to find those solutions. And that's what I've been trying to do in Washington, and I'm going to continue to do that here at home in Arkansas.
Should Nancy Pelosi follow your example and apologize for using that term as well? She used that term as well.
I don't know how she used it, but I think possibly she should. I didn't mean in any way, shape, or form that people should not have or exercise their right to freedom of speech and to be able to speak out. I just would hope that people would be constructive about how we talk about things and how we look for the solutions. This is a problem for every one of us as an American. We've got to be more efficient with our health care. We've got to do a better job at making sure that more people are covered and that we're getting better outcomes, and that, as a part of our economy, we're doing a better job at spending those health care dollars more wisely. So I'm excited about the constructive debate I think that we can have, and that we have had in a very bipartisan way, particularly in the Senate Finance Committee, and I hope we'll continue to do that.
Well, thank you for your time. I know I've gone over, but I sure appreciate it.
No, thank you,
so
Jason.
much.
I appreciate you.